Hello everyone, this is Mohamed Kassin, and this is my journey from when I was sick till I had my operation recently. So it started a few years back. I had some pain in my ear, my left ear to be exact, and after that the pain continued. It worsened till it reached a point where there was pus-like discharge from my ear. Gradually it increased. I went to a few hospitals where I couldn't get a solution. It did reduce the pus, the discharge, but there was no actual solution. So I met Dr. Ghanem from Aga Khan Hospital, Kisumu, and from there he explained to me what my problem was actually, and he even explained to me some things that I hadn't been told before about my infection. Like the bacteria that I had was quite rare and very stubborn. So the only way to eradicate that was through mastoidectomy surgery, which I have done recently. And since that, I think I'm good. The doctors are good. Kind, the nurses are also good, and my stay throughout the few days I've been here was also good and very comfortable. Thank you.
Good day, I'm Dr. Mounzer Ghanem. I'm ENT consultant at Aga Khan Hospital, Kisumu. Beside of ENT, I do head and neck plastic and reconstructive surgery. Today I'm very pleased to talk about the case of Mohamed Kassin, the young man who suffered for years the issue of middle ear chronic discharge, what medically called chronic suppurative otitis media, where there is an infection, and it was nasty infection, concentrated on actually the attic of the middle ear, where is the upper part of the middle ear. It complicated with cholesteatoma, what we call it's a collection of skin, dead skin. It's benign, it's not cancerous at all, but it acts as an invasive, similar to the way of malignancy. It's not malignant, definitely, but it erodes the bone around the inside the middle ear. It erodes the ossicles, where it gives hearing loss to the patient, and it gives him. Beside of it, it erodes the bone around the middle ear, the mastoid cavity, and ultimately, if it left without a treatment, it would reach to the brain and cause intracranial complications. But fortunately, we followed and we treated him medically with local treatment. But this disease, cholesteatoma with suppurative otitis media, unfortunately it's not a medical disease. It's a surgical, and we try to arrange to arrange for his surgery, and we were lucky to find the proper instruments, and we did 2 days ago. We did the surgery, lasted 3 hours, and it was completely successfully. I did what we call it modified radical mastoidectomy, with complete removal of the cholesteatoma in the attic part of the middle ear. Beside of it, the granulation tissue was profuse, was dominant. Unfortunately, his ossicles were eroded, and we had to do our priority. Our goal was complete removal of the nasty infection, complete removal of the cholesteatoma, which is the skin, the dead skin inside the middle ear, and we removed the granulation tissue. We did mastoidectomy with some preservation of the the mastoid, in the posterior wall of the middle ear. At the end of the surgery, we did reconstruction, endoscopic reconstruction of the middle ear wall, and we utilized reconstruction of cartilage reconstruction of the structure of the ossicles in the middle ear. We cover it with fascia, with vascularized flap from the posterior wall of the pinna. Successfully, it was completely successful surgery. I'm very glad that we did something for the life of Mohamed, who suffered, and ultimately we hope to send him back to the normal hearing and infection-free completely. Thank you very much.